Hi, this is Dr. Daria Hammer, a facial cosmetic surgeon, Washington, D.C. Today, we're going to talk about everything you need to know about face and neck lifts. The reason why I make this video is because there seems to be a lot of confusion about what actually a facelift is. So, in my previous video, I talked about the process of facial aging. So, understanding the facial aging is very important to understanding what we're actually doing with a facelift. What are the things that a facelift can do, and what are the things that we can't do? Now, there's a lot of confusion when patients come in as to how we look after a facelift. And also, the second most common question I get from patients is, Doc, when is the best time to get a facelift? Isn't it too early, or should I wait? Well, the answer to that question is very simple. First, we have to identify what happened, how your face aged, where it started, what are the things that you're worried about, or what are the things that you're trying to improve. Then we can talk about what a facelift actually can do or cannot do. So understanding facial aging is key, and the answer to when is the best time to do a facelift, I hope you can answer that question by the end of this video. So when talking about facelift, we talk about the area of the face anywhere from your cheekbones to your jawline, and then if you include the neck, all the way to your clavicle. So the facelift is not what traditionally people used to do, by the way, a century ago. That's how long we've been doing facelift. The entire face where they cut up in your forehead and all around your face and then move the skin back. Those are old methods, and they're really not performed today anymore. I mean, we're talking about a century ago. So today, with advances in medicine, technology, and surgical techniques, as well as anesthesia, all these techniques have been fine-tuned to the point that recovery is fast, natural results, and you can do it within like 3 hours and go home the same day. You don't have to do it in the hospital. As a matter of fact, we have our own surgery center, and all the procedures are performed in our surgery center, and there's no need for hospitalization. But going back to what a facelift really is, it pretty much rejuvenates 3/4 of your face. Incisions of a facelift usually they're hidden. So they're in your hairline, in your temples, and then they're in front of the ear, and they go inside the ear, which is called tragus, the little lip here. And then they go continue, and then ear crease, and then they turn the corner behind the ear. And then depending on how much redundancy there is, they go all the way back into your hair. So they're pretty much hidden. So I will show you some pictures of the incision and the healing process so you can see for yourself and judge yourself whether or not this is a terrible thing like some people think, or actually not that bad. You will see that you can not see where the incision is after everything is healed. But let's go back to a little bit of anatomy so you understand what a facelift actually does, because again, there seems to be a lot of confusion what a facelift actually is. Let's take a step back and review a little bit of facial aging. When the face ages, what really happens, initially, of course, what we see, the skin texture changes, but that's not why we do the facelift. For that, we have various procedures, which I'll talk about in separate videos. The facelift addresses the drooping of the structures underneath your skin, not your skin. Of course, what you see when you look at someone, you just see the skin, and then you judge the look by the skin. But what actually happens, all the muscles and the fat that are attached to your skeleton of your mid-face, upper jaw, lower jaw, those tendons and muscles, they start loosening. The fat starts thinning, and the ligaments holding all these structures will just follow gravity, which goes this way. Okay, so if you look at my face, the way we age, it goes like this. So when I do this, you can see my nasolabial folds deepening, my marionette lines deepening. Everything that used to be here is now here. Everything that used to be here is now down here. Okay, and this happens starting in the late 30s and continues progressively starting from top to bottom in our 40s, 50s, 60s, 70s. Now, a lot of patients ask me, Doc, what is the best type of facelift? Because there's a lot of information out there, and for a layman, it's very confusing trying to make sense of all of that. It's like drinking out of a fire hose. Every doctor comes up with their own tag name for their procedure. I do this facelift, I do that facelift, and patients are confused. And it's sometimes even confusing for some surgeons that perform these procedures. You know, we go to meetings and we see different doctors presenting their techniques, and it works great in their hands. And ultimately, the answer to the question is, to the question that which facelift technique is the best, is very simple. The technique that yields the best result. And we all are trained differently. We all use different but similar techniques. And ultimately, the result will speak for itself. So I don't want you guys to get caught up too much into this technique or that technique, because there's a lot of gimmicks and a lot of terms that are used for marketing purposes, which actually add to the confusion. So today we're just talking about the science and the generic terms of what a facelift is. No marketing terms. So the typical facelift procedure is done once you see the aging that starts in your mid-face and lower face, and that's usually in your 40s. So starting in your 40s, and there's no person in their 40s that haven't stood in front of the mirror and kind of pulled their face up. And the reason why we do that, because we see these lines starting to deepen, and we see these fullness that used to be here dropping down. Further along in our 40s and then into our 50s, the droopiness and the fullness that has dropped down here will drop down here to the jowl. So what the facelift addresses is really reposition, not pull back, reposition those structures. By that I mean the deep structures, the muscle and the fat, to the position they used to be 10, 15, 20 years ago. So we're not changing the way you look. And that's the biggest fear everybody has. I don't want to look different, Doc. You're not going to look different. You're going to look different to right now, but we're going to make you look rejuvenated and a refreshed version of yourself, not like someone else. And that's another confusion. People are scared. They don't want to look like a different person. And of course, like anything else, if you do it the wrong way, you will get results that are not very favorable, not very pleasant. And unfortunately, that's what we typically see on the tabloids, on TV, and in the media, because, you know, it's more fun to talk about dramatic stuff and about terrible results. And there's even TV shows about it. I'm sure all of you have watched Botched, and I love the show. It actually signifies the importance of going and choosing the right doctor, going to the right doctor, making you choose the right surgeon for your procedure, as opposed to just going somewhere that sounds good, usually too good to be true, or trying to shop around for the cheapest doctor. There's always a reason why something sounds too good to be true. But going back to the different facelift techniques, so all techniques, what they should be doing is repositioning the muscles to their natural position. And when you do that, it doesn't matter what technique you use. Once you do that, you will address all these aspects of the facial aging that I just mentioned. And once you've done that, the skin just redrapes back over the muscle, and then the excess of the skin, based on how much deep tissues you actually reposition, will be just trimmed, and then everything is going to be stitched back. And usually after 6 months, you cannot see any trace of the incisions. The swelling has subsided, and your face is settled to the point that no one should really be able to tell that you have a facelift. So that brings me to the next question I get a lot, Doc, but will I look plastic? Now, the word plastic comes from plastic surgery, and what you need to understand, there is also a confusion about what plastic surgery really is, okay? You're not gonna look plastic like a plastic doll or something like that. You're not gonna look artificial. if you see people that look like that, something wasn't done right. All of the things that I just talked about were not really considered and addressed properly. And, that's in anything in our life, It's like getting in a car accident or, a terrible thing happening or tripping and breaking a leg. All those things that happen, they're not really intentional. Now, if they are intentional, if they're due to lack of training or expertise, that's kind of unethical. So that's, again, you have to do your research. So the purpose of this video is to give you some context, some insight and perspective. So when you look for your doctor, you know what to ask, you know what to look for, and you can actually interpret the information you receive, whether you read it, hear it, or see it, with a more informed mind. So if it's done right, you won't look plastic. Like I said, you will look rejuvenated. So all it does, it turns back the clock. Now, there are different techniques which, you might have heard of, a SMAS lift, deep plane facelift, SMASectomy, plication, S-lift, weekend lift. All these are techniques and terminologies that can be really confusing, I must admit, even to some surgeons. I lecture frequently about this topic in academic scientific meetings. I just recently wrote 2 chapters in a 6-volume international textbook about facial aging and facelift. And I have, in meetings, doctors approach me, surgeons that have been doing this for a while, asking me about my techniques, how I do it, and I tell them the same thing. I tell them, I'm doing exactly what you're doing, but slightly modified, and I have reasons for why I do it based on my experience, the judgment of my own results, which every time I do a surgery, I try to improve the outcome, and based on that, my science and my techniques evolve. And of course, the science is out there. I didn't invent the facelift. No one really invented the facelift. It was a process that really started getting more sophisticated in the late 70s, and then with more and more advancement of techniques, got more sophisticated. But the basic structure is the same. We're repositioning the muscles, like I said, and then redraping the skin over it, as opposed to a century ago where they just pulled the skin back and tacked it, and patients kind of looked like it went through a wind tunnel with the corners of the mouth stretched, having the crow's feet stretched, basically everything like that. Today, no one really does that. And if you see someone like that, you can be assured that that was not someone that knew what they were doing at work. So don't be fearful of it, but be aware of it and ask the right question. And like anything else, whenever you choose your doctor, make sure that he or she can show you a lot of before and after pictures, because you want to judge the doctor's work. You want to make sure they can show you plenty of before and afters, because that only means that they're doing a lot of them. You don't want to go to someone that is just dabbling. And another thing is, ask them about the whole process from beginning to the end. Because unless you're very comfortable with the entire process, you shouldn't jump into it. Thank you very much for watching this video. And again, this is Dr. Daria Hamra. I'm a facial cosmetic surgeon in Washington, D.C. Have a great day.